So at Reverse Time, what treatments is it that you actually offer? Because I know nowadays there's so much, isn't there, that's on the market for all sorts of skin conditions, cosmetic treatments, things like stretch marks, fat laser removal, all sorts of treatments. So what is it specifically at Reverse Time that you offer?
Yeah, so at Reverse Time, what I do is I combine my skills as a GP and my 7 years of doing cosmetic, or I don't call it cosmetic, aesthetic work, and put them all together, and my hormonal sort of knowledge, having been a women's health sort of GP for a while. So I would treat problems with pigmentation in the skin, so starting with any issues with the color of the skin being too much or patchy or too little. So that would be treatments like Obagi. You've probably heard of Obagi. So that's like systems, selected systems, prescription skincare, all that goes into treating the skin. I also do certain peels, not the heavy peels, but gradual medium peels that can take away existing damage. These are courses. And then I also provide what's called a platelet-rich plasma. That is basically taking your own blood, centrifuge, spinning it, separating the bits out, and then putting the best bits back in. So they contain the stem cells. So that can actually rejuvenate the skin. So these are rejuvenating treatments. So maintaining and rejuvenating. All my patients will go through a rigorous check of whether they're using the right things for sunscreen. Now this doesn't have to do with brands. I don't actually sell any brands, but it's more checking what they do. The only brands I personally know would be Obagi and Neostrata because they're prescription things. And treatments for existing damage or heavy lines, first finding out the cause of the lines, deciding whether an injectable treatment will suit them, and if they've got age-related volume loss or illness-related volume loss. I'm seeing a lot of people come in with a gym face where the rest of them's like fantastically fit, but their face looking like for them it's like I can't really tell them to eat more fat, so I can restore it back to what it's supposed to look like, but not anything that would distort their face. So that is very important. I can restore their natural balance back to their face. In that you get treatment with all sorts of dermal fillers, and which filler depends on the problem, where I put the filler depends on the problem, how much I use depends on the problem. So each patient is unique and each patient gets a particular way of treatment, but everything is standardized in the sense I only use the products the way they're supposed to be used. Okay, so I don't at the moment do fat removal lasers and things, but I intend to do them. I do the Aqualyx fat dissolving injections, which help to change fat into fiber over a period of time. I do a pretty good treatment of stretch marks. I won't go into the details, but it does involve the platelets as well as a few other things.